and welcome to BioFix Physical Therapy and Fitness. I'm your host, Phillip Carr, and today we're going to start the video off by painting a little picture and seeing if it relates to you or not. Do you experience back pain, maybe a wrapping sensation, tightness or discomfort around the small of your back? Maybe it's one side, maybe it's both sides. Do you feel when it's at its worst, maybe it kind of radiates into your glute region or your butt, maybe down a leg? Is it worse when you're doing kind of daily activities that most people do not complain about? Perhaps you're doing dishes. Perhaps you're vacuuming or just cleaning your house. Maybe it's after a long day at work behind a desk. Or maybe you just want to go down on the ground and play with your 3-year-old son or daughter. If you can answer yes to any of these questions or can relate to any of these scenarios, then the next several minutes could really be beneficial. Stay tuned and we'll show you several different exercises and how they can help reduce your symptoms and get you back to a better quality of life. Before we show the demonstration of the McGill Big 3 lumbo-pelvic stabilization exercises, we're going to address one very important topic, and that's abdominal bracing versus orbeez, the drawing in maneuver. Now, the drawing in maneuver was made very popular in the late 90s, early 2000s. I'm sure we're all in some form or fashion familiar with it. We're basically drawing in the belly button and getting a really strong activation of that transverse abdominis. I'm going to go in a slightly different direction. We're going to do the bracing maneuver, which conversely, instead of drawing the belly button in, if anything, you're going to stiffen and push out a little more. Now, the way I kind of cue this is visualize someone's going to give you a little tap on the tummy. And, instinctively, you wouldn't draw in, you kind of brace and push out a little bit. The reason we do this is because you get greater activation of other trunk muscles. So not only are we getting a strong transverse abdominis activation, we're also recruiting the rectus abdominis and also the obliques. Now this is better for reducing those accessory range of motions in the lumbar spine that I mentioned earlier, which can be responsible for that increased lower back pain and possible symptoms going into your glute or down your leg. But let's go into the exercises. Now we've kind of addressed that, and I will be cueing bracing throughout the rest of the video. The first of the McGill Big 3 lumbo-pelvic stabilization exercises we're going to perform is the modified curl-up. Now the reason I'm starting with this one is because I feel it could be the most controversial, because it resembles at face value what looks as your traditional abdominal crunch, but it is far from that. The traditional abdominal crunch incorporates a lot of lumbar spine flexion, and that can add a lot of shear strain in the lumbar spine, which is what we're trying to avoid. The modified curl up, all the movement is happening in the thoracic spine. You're maintaining a neutral lumbar spine and cervical spine. And again, we're bracing throughout the entire movement. I'm going to get into position and I will show you the movement. Each rep is going to consist of about a 6 to 10 second abdominal contraction. Again, we're trying to build that muscular endurance as it's associated with decreased back pain and return to full functioning activity. I have my hands under the small of my back, making sure I'm maintaining that neutral lumbar spine. And I'm going to maintain a kind of chin tuck position, so my neck and head are in a neutral position. And then I exercise and begin. I'm bracing, barely lifting up. I'm not feeling any movement in my lumbar spine. You should not feel any increased discomfort or pain in your lower back or any increased symptoms going into your glute or down your leg. Next, we're going to demonstrate the second exercise in the McGill Big 3, which is the side plank or the side bridge. This is activating the oblique muscles and the QL muscle, as well as the lateral hip muscles such as the glute medius. I'm going to get into position. This can be done in a variety of ways. I'm going to demonstrate what I consider a lower step in the progression. My legs are going to be bent. To make this more challenging, I can do it with straight legs, and I think you'll have a greater understanding of what I'm talking about when I get into position. So, my elbow is slightly tucked underneath my shoulder. You'll see why in a second, because when I bridge up, it's going to be in a good spot. You can either put your other hand on your hip, or put it on the shoulder to make sure your upper trap's not kind of hiking up. So I lift up. My abs are appropriately braced. The third and final exercise in the McGill Big Three is for the spine extensor muscles and also the hip extensor muscles. It's called the bird dog. And in this position, or this exercise, you're going to be in a quadruped position, which is hands and knees. And you can do this in multiple ways. You can do arms only, legs only, or arms and legs working in opposing directions, meaning your right leg and your left arm will be going, and then vice versa. I'll get into position and I'll demonstrate. So my hands are directly underneath my shoulders, my knees directly underneath my hips, my chin tucked, and from this position, as I mentioned earlier, there's different ways to do this. A regression for this, and probably the most simplistic way is to begin with just the arm flexion or shoulder flexion. And then if that's too easy and you're still pain-free, you can go to alternating legs. Now, a very important check that you need to kind of pay attention to is the position of your lower back. Just like with all the other two exercises, you're trying to maintain a neutral position in your spine throughout, most notably the lumbar spine. So you don't want to see an excessive movement in the spine like so. So when I do the arm and leg extension, I shouldn't see a significant arch or a rounding as you do that. You want to maintain that nice and neutral spine. It should feel comfortable, and movement in that region should be non-existent or minimal. Well, thank you for joining us for the McGill Big Three exercises. We are going to add one little bonus exercise or content, the cat camel. Now, this is not a stabilization exercise, it's a movement exercise, but the reason we do this is because it has been shown that we do need, obviously, some movement in our spine. It just needs to be a controlled movement. We're not pushing the end ranges of motion, and we're not doing an excessive amount of repetitions of the exercise. We are going to assume the same position that we were in the bird dog, but instead of working on that stabilization component, we are going to be going through movement. We are going to stay between 6 to 8 reps, because it's been shown that we could possibly exacerbate our symptoms in the lower back and, in the extremities further if we go we do too many of these reps, or we push the range of motion a little too much. Okay? Get in position. So we are in the same position that we were in for the the bird dog, but instead we're going to be forming the cat-cow or cat-camel. So we're going to start in a neutral position, and then we're slowly, nice and controlled, coming up, flexing, and then going into extension. So nice controlled range of motion. I'm not feeling any increased pain, no symptoms going down my leg or into my glute. I'm doing about 6 to 8 reps. Nice and slow, nice and controlled. So we began the video by painting a little picture of maybe some activities that you do on a daily basis that can increase your lower back symptoms. They increase the tightness or maybe the symptoms into your glute or down your leg, such as doing dishes, just going to work and having a full day of sitting behind the desk, or just playing with your kids. Unfortunately, sometimes those activities are activities that kind of increase our symptoms and make us very uncomfortable. So we kind of went over the McGill big 3 exercises for stabilization. These are designed to be done daily. I would start with about 10 minutes a day. Maybe you start with a 6 to 10 second hold on each rep, starting with maybe 4 to 6 reps of each, and then slowly increasing the volume over a period of time. Maybe you can go up to doing 8 to 10 reps and then pyramiding down to 6 and then 4. So you're really building up that muscular endurance, which we've kind of talked about is associated with decreased lower back pain. At no point during any of these exercises should you have an increase in symptoms. So that's why I kind of mentioned earlier the graded activation or bracing. It doesn't want to be an all out. It wants to be what you can tolerate. If you are getting increased symptoms from that, just back off a little bit. Just like the analogy I gave, you grab a glass of water, you don't want to squeeze it as hard as you can as you bring it up to your mouth. If you have a nervous system, take advantage of it. It will tell you how much usually force you need to apply. A goal too, maybe you start with 10 minutes, is to increase that, but if you are getting any kind of pain and it is maybe not from the contraction, maybe it's just from the sheer volume of exercise that you participated in. So maybe you need to start with sets of 2 to 3 minutes, and maybe you do that twice a day. So you're still getting that volume, like we talked about, the 10 minutes, if you do it 2-3 times a day. And then over a gradual course of time, as your muscles increase endurance and your pain and symptoms decrease, you can make it one time period of 10 to 15 minutes. Again, my name is Phillip Carr. Thank you for joining us today at BioFix Physical Therapy and Fitness. We'll have more videos and content to follow. Some will be rehabilitation and some will be for performance and enhancing and increasing your strength and athletic performance.